Good afternoon, everyone. Welcome to Recognizing and Responding to Trauma in Students. My name is Ashley Castello. We are having a few technical difficulties right now, so my co-presenter Tanya is trying to get on. So if and when she does, she will jump into the conversation. If she is not able to for some reason, then she will potentially just come over here and sit by me because we are in the same office trying to work this out together. So we will do it whichever way we can. So today we are going to be talking about recognizing and responding to trauma in students, and whether that be if you are a clinician working with a student in your practice or an educator working with students in the education setting. Hopefully you will be able to take away some information from this presentation today. And this is a 3-hour presentation, so we will be taking a break at 2:30, giving everybody a little 15-minute break. So just wanted everyone to be aware of that. Also, Tanya, if we can get our difficulties ironed out, will be monitoring the chat, and we will be looking at questions from there. So we hope to be as interactive as possible in this presentation today. So we're going to go ahead and get started. First of all, Tanya and I, neither one of us have any financial disclosures to report. Tanya and I are both eye care specialists, so we wanted to tell you a little bit about our program. We work for the Eye Care Organization, which is the Alcohol, Drug, and Violence Prevention agency that is embedded into the East Baton Rouge Parish school system. We were created in 1981 when some of the members of the community saw a need for drug, alcohol, and violence prevention in the schools. And so they had a vote. They voted on a tax to support this program, and we've been in existence ever since. And there's Tanya. I see she just popped up, so she'll unmute herself in just a second. So we have just recently updated our mission and vision statement because, like I said, our program was created in the 80s, and obviously we're in 2020, so a lot has changed since then. So we have now a 21st century mission and vision, which is that our students will be educated on social emotional coping strategies and trauma-informed approaches in prevention education, and that our team of specialists will advocate for students, community, and the school staff to have safe and drug-free schools. And we will work to empower students and families, and we'll do that by providing resources, technology, and trainings in evidence-based prevention education. So we work with students, we work with schools, we work with parents, we work with community stakeholders to implement this mission and vision. And I'm going to see if Tanya can unmute herself now so she can present introduce herself, because we're going to take a second to do that.
Good afternoon, everyone, and I apologize for the technical difficulties, but we are so happy to be able to join you all this afternoon for this presentation. And so my name is Tanya Chapman Griffin, and I am also an eye care specialist with the eye care program. As we go into the presentation, we love to introduce ourselves, to just give you a little bit about our history, our family life, and why we are so passionate about recognizing trauma. And so again, Tanya Griffin, I am married, and you see in the picture there, I have 2 little girls. One is 5, one is 8, and they are absolutely amazing. And so just in raising them in a time now where we are dealing with some unprecedented experiences, we are dealing with experiences that are new for not only ourselves, but also for our children. And so as a mom and as an educator and as somebody who is passionate just about loving our youth and doing extra things like practicing mindfulness and also teaching Zumba, I am a tad bit overwhelmed. Even though we've been quarantined and been at home, just a lot of things going on inside of my head. So a little backstory. I am a Katrina survivor. I like to let people know that up front about me when we're talking about trauma. So having gone through recent events, such as watching and worrying about the recent hurricanes, looking at the Gulf constantly now, on top of what we're going through as a community with COVID-19, and then other things going on with grief and loss, and just day-to-day operations sometimes feeling overwhelmed, right? And so it is okay for me to be able to acknowledge that with people. And we also want to encourage our students to be able to acknowledge those things as well. And so I'll let Ashley tell a little bit about her life.
Thank you, Tanya. So as a professional, I've been working in education for about 16 years now. I started off as a middle school teacher. I taught sixth grade English, and I love sixth graders. They're one of my favorite age groups. And then I became a school counselor because I recognized that I wanted to make more of an impact with the students that I worked with. So I became a school counselor. I was the school counselor at Audubon Elementary School for 5 years. And then I became an eye care specialist. I got the opportunity to join the eye care team. And I took it because I recognized that eye care was going into the schools, meeting with students, working on some issues that I really wanted to work on. So that's my professional background. And personally, my experience with trauma, and again, like Tanya said on the slideshow, you can see our pictures. That's my husband, Casey, and our two boys, Leo and Max. This picture is a few years old. So Leo is now 9 and Max is 3. And my baby, Max, the little redhead, has a disease called hemophilia. So he was diagnosed 10 days after he was born with hemophilia, which it is a treatable and manageable disease, but without the proper treatment and medication can be life-threatening. It's something that he'll have for the rest of his life. It's something that he'll have to take medicine for the rest of his life. And it can be life-threatening if it's not managed properly. So getting that diagnosis was my traumatic experience, and living through that and having to deal with the grief and the loss of those kind of expectations of normalcy was a very traumatic event for me. So Tanya and I have both had not only professional experience with trauma, but personal experience with trauma, which is why we feel so passionate about it. And I'm going to let Ms. Coletta, if you want to jump in. I know we were kind of frazzled at the beginning because of our technical difficulties, and we skipped over you doing our bio. So if you'd like to jump in and do it while we're introducing ourselves, please feel free. And if not, we'll carry on. So I'll give you just a second if you want to jump in.
Thank you, Ashley. I just once again want to welcome everyone and thank you for attending the 2020 Behavioral Health Symposium. We are happy to host this event as a virtual conference because we care about your health and safety, but we also understand how important it is to provide relevant and robust continuing education to Louisiana healthcare professionals. For quality purposes, all participants will be muted during the presentation. If you would like to submit a question to the speaker, please use the Q&A feature in the virtual platform. The session is accredited for 3 hours for the following: social workers, clinical credit, nursing contact hours, AMA, PRA Category 1 credits, psychologists, peer support specialists, and licensed professional counselors. So you guys have already heard a little bit about our presenters today, but I'll go ahead and get ready to give you some more information about them. Ashley Castello and Tanya Chapman do not have any financial disclosures. None of the members of the symposium's planning committee or any session moderators have any financial disclosures. This session is entitled Strategies to Recognizing and Responding to Trauma in Students. Our presenters today, as you've already met, Ashley Castello and Tanya Chapman. Ashley is an educator with 16 years of experience in the East Baton Rouge Parish School System. Her career in EBR began in 2004 as a middle school teacher. In 2009, she obtained her Master of Education in School Counseling and served as Audubon Elementary School Counselor for 5 years, being honored as the Elementary School Counselor of the Year in 2013. In her current position as eye care specialist, she provides prevention services to 5 schools in EBR and the adjudicated youth program as a licensed prevention professional, and is a certified Assist, Safe Talk, and ACEs trainer, providing suicide recognition and intervention training and trauma-informed care training to EBR employees as well as other community agencies and service providers. In 2019, Ms. Castello was named Licensed Prevention Professional of the Year by the Louisiana Association of Substance Abuse Counselors and Trainers. She resides in her hometown of Baton Rouge with her husband, Casey, and their two sons, Leo and Max. She is joined today by Tanya Chapman Griffin, who has been an eye care specialist for the East Baton Rouge Parish School System since 2014. Prior to that, she was a business education teacher and PBIS team leader at Bel Air High School in EBR Parish. In 2002, she obtained her Bachelor of Science degree in psychology. From there, in 2005, she obtained a Master's of Business Administration, and in 2009, she obtained an alternative teacher certification in business education. In her current position as an eye care specialist, she educates school students in drug, alcohol, and violence prevention. She also coordinates school-wide prevention initiatives for the EBR school system. Since 2011, Ms. Griffin has been a positive behavior in schools team leader and an all-pass school team leader. I hope you all enjoy the presentation today.
Thank you so much, and I'm sorry we skipped over that. We got a little excited and want to get right into it. So thank you, and I'm glad you've had the opportunity to meet us. It sounds so fancy when somebody else reads it. So now that you've had the opportunity to meet us, let's go on with our presentation. So our objectives for today, we hope that after this presentation, you will be able to define trauma, recognize the signs of trauma in students. Oh, excuse me, let's go back. We're not done with objectives yet. Recognize long-term effects that trauma has on students. We'll talk a little bit about the ACE study and a few other evidence-based theories for trauma-informed care with students. We'll talk about some techniques that you can use that are quick and easy to use for responding to children who have experienced trauma. We'll talk about resilience, how important it is, how to build it up in students. And we'll talk about self-care. We'll define it, we will talk about its importance, and we will talk about some skills that you can use for yourself as a trauma care provider, and also for the students that you work with who have experienced trauma. So what is trauma? Trauma is, and I'm going to go from the left side over to the right side and then back over to the left side. So first of all, it's a deeply distressing or disturbing experience. And some examples of that are domestic or family violence, community violence, which we know as a community, the Baton Rouge community, we definitely have some experience with that. Any kind of abuse, so emotional abuse, physical abuse, sexual abuse, neglect, all those kinds of abuses. Bullying can be considered a kind of abuse. Natural disasters, which again, we know in our community, we've experienced that multiple times. A major car accident can be a very traumatic event. The death of someone close, the incarceration of someone close, a serious injury, so like a boating accident or car accident, loss of limb, a near-death experience, those can be traumatic. A life-threatening health diagnosis, like I mentioned with my baby earlier. And then war or political violence, which we are also seeing a lot of currently right now. So this is definitely not an all-inclusive list. We just wanted to give you some examples of some things that can be considered traumatic. And that's when I'll jump back over to the left side of the screen where it says, trauma is the feeling that an experience has been deeply distressing or disturbing. So anything really that feels like trauma to a person can be considered trauma. So even if it's not on this list, even if it's not on the ACEs list that we'll talk about a little bit later, if a person, a child or an adult experiences something and they consider that event traumatic, then it can be considered a trauma.
And so here we just wanted to make sure that we put in some data when we talk about prevalence of childhood trauma. Childhood trauma occurs a lot more than you think, right? And so this first graphic talks about each year the number of youth requiring hospital treatment for physical assault related injuries would fill every seat in 9 stadiums. And so when you think about football, right? I love Death Valley, right? We're excited to get back to football. We think about all of those seats being filled 9 times with children who have assault-related injuries. That is to a magnitude, right? And so we take a look at the second graphic. It says 1 in 4 high school students has been in at least one physical fight. 1 out of 4, 25%. 1 in 5 high school students was bullied at school. 1 in 6 experienced cyberbullying. And now when we're in a time with more virtual learning, do we think that cyberbullying is occurring more now than ever? It's a possibility. 19% of injured and 12% of physically ill youth have post-traumatic stress disorder. And so now we're talking about the situations that we're in with COVID-19, the levels of illnesses on top of a virus that we knew nothing about months ago. 12% of physically ill youth. This data actually comes from 2014. So it's easy to say that now in 2020 that data could possibly be a lot more. And more than half of U.S. families have been affected by some type of disaster. And in this area, in this time of year, that number is 54%. Let's think about what that data could look like for the state of Louisiana specifically. And this data has come from the National Child Traumatic Stress Initiative. So we wanted to be sure that we shared that resource.
So I'm going to talk just a little bit about the ACEs data because it also gives us a good picture of childhood trauma. I know many of you are probably very familiar with the ACEs study, so I'll just give a quick background in that the ACEs study was done to study the effects of childhood trauma on health results in adults, and it was done through an insurance company in San Diego, California. So it was done with an affluent population, a mostly white population, a mostly well-educated population. And what they found by interviewing those people was that ACEs are common. So if you've never seen the ACE questionnaire, there are basically 10 questions on there, and they ask about these 10 things that you see on the slide right now. So the 10 ACEs that were studied are household dysfunction. They fall into these 3 categories: household dysfunction, neglect, and abuse. Substance abuse, parental separation and divorce, mental illness, battered mothers, which battered mothers means any battered female caregiver. So if a child was raised by their aunt or grandmother and that female was abused domestically, that counts as a battered mother. And then criminal behavior, which is evidenced by a household member being incarcerated. And then emotional and physical neglect, and emotional, physical, and sexual abuse. Those are the 10 ACEs that were studied. And how the ACE study worked was basically people were given a questionnaire about these 10 things, and the questions were worded such as, from ages 0 to 18, did you have a battered mother? They're yes or no questions. From ages 0 to 18, did you experience emotional neglect as evidenced by X, Y, and Z? And those are yes or no questions. So it wasn't even, how severe was the trauma? How often did you experience the neglect? It was just a yes or no. And that's how they got the ACE score. However many yeses you had to those questions determine your ACE score. So that's what the study was. And I'm gonna come back to why that's important in just a second. So in that population with those 10 ACEs, what they found was that only 1/3 had never experienced any childhood trauma, but 2/3 of the population had experiences with childhood trauma, adverse childhood experiences. So when I want to put those two things together. The ACE study only focused on those 10 specific traumatic events. And in this mostly white, mostly educated, mostly affluent segment of the population in San Diego, California that this study was done with, over 2/3 of the people still had indicated that they had experienced childhood trauma. So think about what that means for our population here in Southern Louisiana, where we are not mostly white, not mostly affluent. So, and we know that we've had experiences with more than the 10 traumatic ACEs that were studied in this study, because natural disaster is not on that list. And we know that natural disaster is traumatic, and we know that we've been through multiple natural disasters here in Louisiana. So I'm saying all this to say 2/3 of the participants of the ACEs study have experienced trauma. Just imagine what that means for our population. Our number is much higher than that. And again, what the ACEs study found and why it's important to know the data is that the ACE study found that there's a dose-response relationship. So the ACE study was studying these people as they were adults, and then it asked them about their childhood trauma. And because it was done through an insurance company, they were then able to look at health problems in those adults. So as the number of ACEs went up, the number of health problems went up as well. So if you had 3 or more ACEs, you are 30%, 35% more likely to have health problems, and so on as you go up. As you get more ACEs, the more likely you are to have health problems and mental health problems. So we found that there was a correlation through that study of trauma and health and mental health problems, and that's the big takeaway from the ACEs study. And so childhood trauma, even though it occurs during childhood, is a lifelong impactor. So it's going to affect people into adulthood, not only with their mental health, but also with their physical health. Okay, so we want to talk about recognizing the red flags in the children that you work with. So disturbance in eating or sleeping patterns is one. If you have a kid who just all of a sudden is never hungry anymore, or you have a kid who used to be an early riser and now they want to stay in bed till noon, that's an example of a disturbance. Complaints of not feeling well, like a headache or stomach ache. So again, with kids, children often do not have the vocabulary to express how they're feeling. They do it through behavior. And so if they can't express how they're feeling in words, they may say, I have a headache, I have a stomach ache. Or they may actually be having headaches and stomach aches more often, because that stress and the stress effects of trauma, we know, can have physical effects as well. So if they're complaining more of headaches and stomach aches, that can be a red flag that they've experienced trauma. Increased nervousness and anxiety is a sign. Irritability. So just think about a kid who's cranky all of a sudden, and seems like they're cranky a lot more than they were before, a lot more often. Fearful and easily startled. This is a good example with not only natural disasters, but also potentially gun violence. So if a child has experienced gun violence or a natural disaster, they might respond negatively to loud noises, because, you know, in a storm, if a branch falls, or, you know, that wind can be very loud. So loud noises can make children fearful and easily startled after the trauma. And then withdrawn and aggressive. So again, those are symptoms that will come up after a trauma event is experienced. So if a kid has always been shy, then that doesn't necessarily mean they've been through a trauma. But if all of a sudden they start to withdraw, then that could be a red flag. And again, we call these red flags because just because a child is experiencing these symptoms, it doesn't necessarily mean that they've been through a trauma, but they're things you want to look for. And if you see them, then that alerts you to kind of be more on guard and dig a little deeper and find out what's going on. So for example, if a kid starts complaining of stomach aches, they may actually have some medical issue that's going on that they need to go to the doctor for and get resolved. But it could be a traumatic experience as well. And also, these red flags are helpful because if you have a child that you know has been through a traumatic experience and you're wondering if they've been affected or how they've been affected, if you start to see some of these red flags, then you know that child is going to need some help, because they are having a hard time dealing with the trauma that they've been through. So that's why these red flags are so important. Those are, on the last slide, those are kind of some short-term red flags that you might see, behaviors that you might see kind of pop up. But trauma also has long-term effects. And this graphic over on the left is from the ACEs presentation as well. And what it shows us is that trauma affects the brain, and it affects brain development. And it does that because what we see in the graphic is the development of the neurons and the synapses of the brain as a child develops. So at birth, they don't have very many. A baby only needs to know how to go to the bathroom, cry, drink milk. Those are only the few things that they have to know, right? So they don't have very many developed. By the time they get to elementary age, 6, 7 years old, think of all the things a baby learns between infancy and kindergarten. They learn how to walk, they learn how to talk, they learn how to crawl, they learn how to dress themselves, they learn how to socialize. They learn so much. So that's why you see all those connections, all those neural connections in there. And then by puberty, the brain has kind of automatically pruned away some of those neurons that have not been used as often. So if a child is being nurtured and well educated throughout their development, then those are the neural connections that are going to be combined and strengthened. And if they're learning a fight or flight response because they're in a toxic stress traumatic situation, then those are the neural connections that are going to be strengthened. So depending on their environment and depending on their experiences, that determines how their brain develops. So some long-term effects that you might see in a child, knowing all that, some long-term effects you might see are developmental delays. So delays in normal development, like a child who is not potty trained at the right age, a child who doesn't get potty trained till later on, 5, 6, 7 years old. That's a developmental delay. A speech delay could be a developmental delay. They're not talking in sentences by age 3, which a child should be doing. So those can be evidence of trauma because, again, that trauma affects the way the brain develops. Learning disabilities can be another indicator that trauma has been ongoing because it affects brain development. So the foundation for the brain and what it needs to know, just like in school, when you build upon those skills, starting in kindergarten, you learn the alphabet and then you build to words and then you build to sentences. The same thing is true of your brain. It learns those basic rudimentary skills first: eat, walk, talk, sleep, and then it learns how to do higher order thinking, socializing, math, and science. So if that brain development is affected, then the ability to learn is also affected. Some other long-term problems are ongoing social problems and general and frequent behavior problems. So think of those kids who have a problem getting along with others all the time. They never fit in. They can't do group work. They can't work well in a group. None of the other kids at school want to be friends with them. They get in trouble all the time. And that's because they are always having a hard time. So when we see kids, you know, and we work with kids, Tanya and I have been educators for a long time. We're working with kids for a long time. So what we know is that kids behave a certain way for a reason. And so if you have a kid who's always getting into trouble, there's some reason behind that behavior. So these are things that are always worth looking into. Now, a child may have a developmental delay because they have some physical or medical condition that's causing that. So these are always just things that are red flags for you to dig a little deeper to find out if there's been a trauma or if a trauma has affected a child in the way that you maybe suspect it has.
And so I just want to let everybody know that if you are on Zoom and able to access the chat, that the chat is open and we are watching that, and we appreciate the comments in the chat actually on the app as well. And so we want to engage you in some conversations. What have you noticed about trauma? And if you can comment for me either in the chat on Zoom or in the chat on the app, we would greatly appreciate that. What have you noticed about either trauma with students, trauma with your kiddos if you are a parent, or even trauma with yourself? And we're going to go ahead and take those in and discuss that. What have you noticed about trauma? And I see here that someone has put that they notice that trauma affects your physical body. Trauma impacts us all differently. Yes. What have we noticed about trauma? And if you are a parent in virtual learning right now, you probably see your students on the computer doing what I see and what I wonder. And so we decided to plug that in with this presentation as well. So what have you noticed? That it manifests in many ways. Thank you so much. And some are not even visible. That it affects the entire family, not just the person directly that may be experiencing something specifically. We have in Zoom heightened startle reflex and sleep disturbances. Yes. Anyone else? Behaviors, including withdrawal, sadness, low self-esteem, social isolation. Some people don't know that they are even experiencing it. The perception of an event being traumatic is different in different people. And let me finish that because that's really good. The perception of an event being different in different people and in the same person by different situations, right? So something, just like I'll talk about Hurricane Katrina for me, I've realized that that traumatic experience will never go away. It's 15 years later, and I still bring it up almost every other week, right? And so for somebody else, it may not have affected them the same way. Emotionally reactive infants, toddlers, and school-aged children. Yes, so we will talk more about those specific age groups and recognizing the signs in those age groups. So thank you for sharing that. We have noticed young children having increased anxiety and confusion along with sleep issues. Some people not knowing that they have it, usually some unhealthy coping associated with the trauma. Sometimes it may not be identified as trauma for the student and it's normalized in some way, right? And so I'm interested to know if you think that trauma affects adults the same way that it affects our students or our kiddos. Do you think that trauma affects the adults the same way that it affects the students or the kids? Everybody is saying yes. Okay. And so, yes, Hurricane Laura is a repeated trauma for Katrina survivors without a doubt. Without a doubt. My mom is still in New Orleans and she said that she could not watch the news and she said she felt the exact same way with Laura hitting our other family in Lake Charles the same way Hurricane Katrina hit us, even though Baton Rouge and New Orleans, fared out a little bit better this time. So definitely people are still saying yes. In most ways, trauma can affect adults the exact same way. So thank you all for that. Now, what I would like to know is, what do you wonder about trauma? What do you wonder about trauma? And I appreciate people still talking in the chat saying the current trauma of current events like the pandemic, racial injustice, and weather events, right? So we're seeing those different types of layering effects with trauma across the board. So I'll go ahead and say something personally. Personally, with coronavirus being out, being an educator, being a mom, and still trying to be supportive to students and coworkers, the layering effects of also being an African American woman in this time and dealing with those situations has been overwhelming. So much so that it has affected my physical health, not being able to sleep. Now I have high blood pressure, being frustrated, right? Small triggers that can kind of set me off, and emotionally, I can recognize that something's not quite right. But I also started to pay close attention to my two little ones at home, realizing that my trauma and my traumatic experiences possibly bleeding over into them, constantly watching the news, looking at the weather, looking outside and having 30 sandbags and no water in the street, but still having 30 sandbags, right? So just paying close attention to my mood, my thought process, and also theirs. And so we encourage everybody to just kind of keep their eyes peeled on the students and the little ones. So what do you wonder about trauma? Let's go ahead and put that in the chat. What do you wonder about trauma? What do you wonder about trauma? And I'll give mine as an example. I wonder if trauma is long term or short term. Is it something that I can go take medicine for and it'll just go away? I wonder, does anyone ever get over it? I wonder if a child had a traumatic experience but was removed before the true trauma experience begins, will that child still display some symptoms of trauma? That's a really good question. Thank you for that. So if a child is removed before the true trauma happens, will they still display some signs or symptoms? Anyone else? What do you wonder about trauma? Okay. Will medicine relieve trauma? Go ahead, Ashley.
I just want to say regarding that one comment that
Mm-hmm.
if a child does have to be removed from a situation, that in itself is traumatic. So I would imagine that there's definitely some trauma involved there.
Yeah. So let me say this because I appreciate everybody giving feedback and commenting, and that's what we want. We are educators and teachers by nature as well. And so this is an open conversation, not just us talking at you, because we have a lot to get out of, and we recognize that even in our community, we may be the people who are labeled as professionals and experts right here today, but we also know that healing takes place through conversation, and we all need to be able to communicate and say some things today. So in that, I appreciate the comment made here, although trauma never really goes away, but what could be the best way to overcome traumatic experiences, especially when individuals don't exactly know what even triggers them? That's pretty deep. When you don't even recognize what the triggers may be. Okay, also, someone said long-term physical effects. What are the long-term physical effects of trauma? And then someone else said, your statement made me wonder how much our trauma bleeds into kids without realizing it. Yes, because as a mom, I had to swallow a really big pill to see my 5-year-old running around the house trying to make her own personal sandbags because I had sandbags galore, right? So when she realized why we were making them and having them, she felt like she needed to have them. And then once it started raining, guess who was in my bed every night because I created that, right? I bled onto her with that. I wonder what tools can be helpful for folks with trauma. How does someone overcome reoccurring trauma that carries over into adulthood, right? Year after year, we talk a little bit about anniversary trauma. When you look at that calendar, something that happened on a specific date, like what I'm talking about, and every time that comes around, no matter what, you have those same feelings of anxiety and stress. How does a child who experiences trauma under the age of 10, how does it affect them during puberty, when emotional and physical changes occur? How much indirect trauma affects the siblings of the person experiencing the trauma firsthand? I wonder long-term physical effects. Is it constantly, are they constantly being in that fight and flight state, or, for example, a fast heartbeat, lack of sleep, etc.? So are those long-term effects constantly being uh, going throughout with that person? So we appreciate the what we wonder about, and we will cover most of those. And so please stay active in the chat and also on the app as well. Okay. Did you want to address any of those specifically, Ashley?
Yeah, I did. So I was trying to quickly jot down your questions while Tanya was reading them off because, and so I'll address the ones I was able to jot down. One of the questions was about triggers and what if you don't even know what the triggers are? So we'll talk about that. I'm not going to answer the question right now, but we will talk about that in just a minute when we talk about emotional intelligence and how that can be one of the effective treatments of trauma. One of the effective tools is learning how to recognize triggers, recognize emotions, and kind of identify what's going on when you have those emotions so that you can realize that you're being triggered by something or that your student is being triggered by something. Someone asked about long-term physical effects, and so that goes back to the ACEs study. We know that there are long-term physical effects from trauma. And so I just would point you back to that information. There's tons of information on the ACEs study out there. You can find a great deal of it on the cdc.gov website, but the information is definitely out there. And that's exactly what that study told us, is that yes, there are long-term physical effects from trauma. Somebody said they wondered if trauma was bleeding into kids without realizing it. Tanya made a comment about her own personal experience, but definitely yes. There's a whole field called epigenetics that studies, excuse me, not only is the trauma that we're experiencing as adults, are we kind of passing that off onto our kids, but also genetically, it has been shown that we can pass that on. So there was a study done, and I cannot quote the study, you guys, but I can tell you about it because we learned about it in the ACEs training, where mice were shocked repeatedly and given the smell of cherry blossoms. So repeatedly they were shocked and given the smell of cherry blossoms to where they grew to fear the smell of cherry blossoms. Then those mice were bred, their babies were never shocked, but were exposed to the smell of cherry blossoms, and they huddled in the corner fearful because that genetic link had been passed down to them that they should fear that smell. So that's a great question about our trauma bleeding into kids, and the answer is yes, it can. Not only can they pick up on our emotions and what we're feeling and what we're kind of unconsciously putting out there, but our trauma from childhood, we can kind of pass that on generationally. So it's a very good question, and yes, it definitely exists. Somebody asked about changes in puberty. Can childhood trauma or the way a child deals with it change when puberty comes along? The answer is definitely yes. And again, it goes back to that brain development. So when a child goes through puberty, their brain and their body are both experiencing a lot of changes. And so something that never affected them before might start to affect them. Something that they never thought about in a certain way before, they might start to think about in a different way when they start to experience puberty. So yes, that can definitely have an effect on them and their experience with a past trauma. And then somebody mentioned a fast heartbeat as like a symptom of trauma, which we'll talk about later too when we talk about deep breathing as a technique, because it has, there's an institute, I don't even know if I have it on the slide, but it's called the Heart and Math Institute. So if you look that up, there's a whole set of data and research on heart rate in trauma survivors. And it has been shown that trauma survivors have a higher resting heart rate because yes, their heart rate is elevated because they're constantly in that kind of survival fight or flight mode. So you guys have some great questions, some great wonderings. I'm going to tag Tanya in just a second. And I think what we talk about in the second part of our presentation, when we talk about some of the evidence-based practices and some of the quick tips and techniques, are going to hopefully give you ideas for answering those questions.
Yeah, thank you. Okay, everybody, we're in the same room, everybody, but we're at least 7 feet away. I don't want you to think we're like right here, but we wanted to be able to look at each other's eyes and keep things on the slides that we choose to. But I want to read 2 things that I'm seeing in the chat. I wonder how much day-to-day behavior students have is normal due to normal issues like being tired, hungry, etc., versus due to residuals of their traumatic experiences. And so that's something to really think about. Is this something that is normal because a child does not have their basic needs being met, or are these residuals of our traumatic experiences? And so we know now with everything going on, everybody's level of stress and trauma is a little bit higher because it's so widespread. So we may not currently be able to even decipher whether it's normal issues or residuals of traumatic experience. So that's something to have in the back of your mind. We may not be able to tell the differences up front right now. And then also on the app, how protective factors and resilience, and we will cover a little bit about that further on in the presentation, how protective factors and resilience impacts kids' response to trauma. I wonder how many times we as providers assume trauma to be worse than what a child actually experiences it due to their strong family and community supports. And so we will also talk about how, as professionals, we are a part of those protective factors and how we don't want to re-traumatize our youth, but we do want to show them that we are supportive of them and that we are a part of the protective factors. We also want them to see on their own that there are healthy coping skills and that there are risk factors that they can choose not to participate in, right? So initially, I'm gonna use myself again, initially when we were all quarantined, my healthy coping skills, so I thought, would be Mexican food and CNN. Well, those turned out to be unhealthy coping skills because I didn't do anything but watch CNN and eat Mexican food all day as my unhealthy coping skills, okay? And so just wanted to share that. I also wanted to say briefly, and we're going to go to break in like 3 minutes, what you wondered specifically in regards to like age specific trauma signs. I want to give that and then we can go to break. Preschool children, fear of being separated from their parent or caregiver, crying and screaming a lot, eating poorly or losing weight, having nightmares, and using the potty on themselves, right? Elementary school children becoming anxious or fearful, feeling guilt or ashamed, having a hard time concentrating, having difficulty sleeping. And then also middle and high school children feeling depressed or alone, developing eating disorders or self-harming behaviors, right? Beginning to use alcohol and drugs, and becoming involved in risky sexual behavior. And so we really are passionate about looking at trauma in children and having trauma informed care, because trauma could very well be the start of using drugs and alcohol and making these unhealthy choices. And so if we can take a collective approach to looking at trauma and how we can all focus on being those protective factors and increasing the healthy coping skills, then it is safe to say that our children will not feel like they need to use drugs and alcohol to cope, right? They will not engage in risky behaviors to kind of soothe how they're feeling. All right. And I also see in the chat, but Mexican food does make you feel better for a little bit. It made me feel amazing, Megan, absolutely amazing. So, so I thank you for that. So I'll let Ashley go ahead and close us out for a break and let us know when we'll be able to come back.
Okay, thanks. Yes, so I just want to mention too, the comment that was made about residual trauma and whether it's just like a stomachache or a headache or something like that. What we're going to talk about in the second half, the good thing is that these practices are useful for anybody, even if they haven't experienced trauma. They're just great theories to use when relating to other people and connecting to other people. So that I think that will be useful anyway for the person who asked that question, hopefully. So it is 2:35. We're going to take a 10-minute break and come back at 2:45 for the last hour of the presentation. And in that hour, we'll talk about practices, evidence-based practices and practical techniques that you can use with kids, mindfulness and self-care. So enjoy your 10-minute break and take some care of yourself during that. And we'll see you back at 2:45.
Okay, welcome back, everyone. We want to be, oh goodness, I lost one of my earplugs. We want to honor your time and we appreciate everybody coming back. So I do see a question in the chat that says, is this over at 3:45 or 4:45? And so I just want to make sure I am correct. We are going until 4:45, and that's why we definitely want you all to be interactive and to engage. And so in that, our back from break icebreaker is about self care. So, what I want you to do is think about the categories of self care, the wide ranged categories: physical, mental, spiritual, and professional. And so, thank you so much. So, we are correct about 4:45, y'all. We are here for the long haul on the Thursday before Labor Day. So, stick it in with us, and let's get this great information. And also, we have a treat towards the end just for you as a professional. So, we're talking about self care again: physical, mental, spiritual, and professional. In those categories, can you please put for me in the chat the category and either a way that you have conducted self care for yourself with that category, or a way that you could do more, right? So the category for me could be physical, and I could put I could exercise more, right? So either in the, oh, y'all are already on it. So physical, bubble bath, massage, physical yoga, spirituality, prayer, and then also feel free to use the chat on Zoom as well. Okay, walking, so that would be physical. Thank you. All right, physical, eating better. Yes, me too. I cut out all the Mexican every week. Physical, definitely exercising more and making sure to drink plenty of water. That is right. Staying hydrated is very important, as well as getting enough sleep. Let's see. Physical, walking more and more water. Physical, walking, spiritual, books and prayer, increasing exercise and relaxation. Physical and spiritual. Church, even on the line. Yes. All right, going to the nail salon and the spa, eating better. Great, this is great, y'all. Staying in the Word, praying, meditating, reading a daily word, and reading from a spiritual perspective mentally. Like to read and a hit, bubble bath. Okay, and prayer, physically walking more, and reading. All right, finding a quiet place to stay away from people and stuff. That's right, because sometimes we have to protect our energy, right? By being around too many people or too many things going on, kind of protecting your space. Cooking and sharing meals with family, neighbors, and friends as a source of relaxation. Walking, exercising more, and drinking water, y'all. The exercise and drinking water, I think we are all trying to step up with that. Having fun time with your children. So, Sandra, I'm going to call you out because I had to make a decision whether to have a line. I teach line dancing and fitness classes, and I'm supposed to have a Friday line dancing class, and I decided to cancel it because, like I said, my little one had a rough weekend with following me with all of her homemade sandbags. So I decided to take the afternoon off tomorrow and just kind of like spend time with my kiddos. We're gonna play soccer in the yard. Praying, exercising, taking a ride, spending time and having fun with my children. Connecting with positive people is very, very good for self care. I think we all can remember a time, or remember a time even today, when you encounter somebody who is negative and you feel that negative energy by either what they said or what they did and how that made you feel. But as an adult, sometimes we are better with being able to communicate our feelings and get that out. But when we think about our young people, they may not be able to communicate that as effective as we would. So that's something to think about. Looking at less, CNN, MSNBC as well. Yes, Linda, I'm trying. I really am. Professional, using supervision and consultations appropriately, helping others in need. So definitely serving others can be very rewarding, right? But something, but just also being mindful that if you have more that you're putting out and you don't have anybody pouring into you, then just be aware that that may or may not be self-care depending on how you feel afterwards. Watching funny movies and sitcoms. Game night with my kids and grandkids. Yes, can I come over and play games with you all? All right, so thank y'all so much for that. So I think everybody right now is aware of self-care, but I think we all could step up a little bit more with how we are caring for ourselves so that we can continue to pour into others, especially the little ones that we encounter every day. So I appreciate that. And if you want to keep putting those in, we'll keep reading them, but you did an awesome job with self-care. We'll talk a lot more about self-care, and we're going to take an opportunity later on to just relax with each other as professionals and take a break and show you all how you can take some meaningful, intentional breaks a little later on. So Ashley is going to dive back into evidence-based information, and we thank y'all for coming back with us.
Welcome back, everyone. So let's go to the next slide. All right, so we are going to talk about how to respond to children. We're going to talk about a few evidence-based practices and theories, and how you can use them with kids. So the first theory that we want to talk about is TBRI, Trust-Based Relational Intervention. And this was developed by Karen Purvis at the Institute of Child Development. She's in the psychology department at Texas Christian University. This theory was developed based on her work with foster children and children in orphanages, so children in the foster system. And basically, the theory is that to help a child, you focus on building a relationship with that child and building a relationship of trust with that child so that the child can trust you. And the focus is on empowerment of the child and connection with the child. So the little graphic that we have here is just a great example of TBRI, and it definitely starts in infancy and childhood. A child learns in infancy whether or not they can trust the adult whose care they are in. And they do that by, they cry, right? A baby, when a baby needs something, cries to let you know that it needs something. When you respond as the parent or the caregiver, then you are telling that baby with your actions that I will help you, that when you have a problem, I will be there to help you. And you do that through doing it over and over again, making contact with the child, healthy touch with the child. Those are all tenets of TBRI. And so basically what that means for us as professionals is that's what we need to do with the kids we work with if we want them to trust us to help them through their trauma, is that we need to develop that trusting relationship. And if a child has been through trauma, then there's a chance that especially if it's been some sort of abuse or neglect, then there's a chance that they have had a relationship with an adult that they thought they could trust, and the adult betrayed that trust by abusing them or neglecting them in some way, by causing that traumatic event to happen to them or allowing that traumatic event to happen to them. So TBRI says that you can help a child by having a relationship with them, by connecting with them. So we'll talk a minute about practical techniques that you can use that are embedded in these theories that we're talking about. So things you can do. But this is just, we kind of just wanted to tell you about the theory that we're basing these practical applications on. So TBRI is one of them. And Tanya is going to monitor the chat. So if you guys have any questions about TBRI or about emotional intelligence, which we'll talk about in a minute, at any time, if you have a question, please put it up there, because we would love to address your questions in real time as we go. So please take advantage of that. Okay, so another evidence-based practice, that theory that we'll pull from when we talk about responding to children, is emotional intelligence. Emotional intelligence basically refers to recognizing, understanding, and being able to express emotions. And somebody's question earlier about triggers and being able to identify triggers, I think has to do with this. And I think this would be a very helpful theory to help somebody understand their own triggers, because that's what this is all about. When you feel an emotion, so Tanya uses the example of the storm all the time, Katrina, and we use the example of the flood here in the Baton Rouge area in 2016, because it's something that almost everybody can relate to, right? So I did not flood in 2016. My house did not flood. I was pregnant at the time. I was terrified that we were going to flood. There was flooding all around us. Luckily, we did not flood, but I still get very anxious, very stressed out, very worried when a big storm is coming. When the rain, when there's a heavy rain, you know, when water starts to build up on the street, I still get a lot of anxiety about that. So as an adult, I can identify that, right? I can say, okay, I'm having to take some deep breaths. I'm feeling very stressed out. My heart's beating fast. I know that that's because of the impending storm and because of what happened before. So I recognize that. I can understand that. That helps me be able to deal with it, to take some deep breaths, to, you know, make sure we have sandbags in front of the door so that I can worry a little less about what the storm that's coming. So what's so important to think about in that example that I gave you is with a child who's experienced trauma, they have that same kind of stressed out feeling, but they don't know why. They're not able to go, oh, I'm walking around feeling stressed out because I watched, you know, my mom and dad got in a fight last night and it got very violent. And today I'm walking around feeling stressed out because of that. And so they're just walking around with that stress, not knowing what it's all about. And so that's why emotional intelligence is so important, being able to identify those emotions, understand why you're feeling them, and then to be able to respond to those emotions and do something about it. And that's what we'll talk about when we talk about some of the practical solutions. And we'll spend a good bit of time talking about mindfulness and actually practicing some mindful techniques, which I know everybody, I'm sure, will appreciate at the end of the afternoon, being able to take a little mindful break and do some practices. I just want to mention Dr. Mark Brackett, because I think he is the kind of forerunner on emotional intelligence currently. He is the director of the Yale Center for Emotional Intelligence. His team just put on a huge convention 2 weeks ago that we all attended as eye care specialists, and I think he is kind of the face and the voice of the emotional intelligence movement right now. So if you're interested in more information, he has a book that he just published, lots of good information, lots of colorful charts to help yourself and your kids kind of understand, and your parents that you work with, understand emotional intelligence. So a lot of the practical applications that we'll talk about in a minute come from this theory, and they also come from TBRI. They also come from the evidence-based practice of mindfulness, which Tanya is going to talk to you guys about.
Okay, I just want to kind of piggyback on what Ashley said with the last slide, talking about emotional intelligence. I think in the beginning when we asked about what do we wonder and what do we notice, one of the comments mentioned being able to decipher between if a child is actually going through trauma or maybe not having their needs met, and then feeling anxious or stressed about that particular thing. And so what I did was I found an acronym from PBS, and it talks about turning down the fire hose. And as a parent, I've decided to use this in my home, but as an educator with our students going back to physical learning, I want to be able to share this resource with you as well. Turning down the hose. And so the acronym is HOSE. And so you ask yourself or the child these questions. Am I hungry? And then, so that means that the behavior is coming from them not being fed or wanting something to eat. Am I overstimulated? The letter O. Overstimulated, like with my children being on devices or virtual learning all day long. Have they had too much of the stimulation? The S, are you sleepy? Do you need rest? Are you tired? Are you exhausted? And then that E I found very interesting. Do I need exercise? Is it that the child has been in a confined space for a long amount of time? Is it that you need to be able to move and encounter some different experiences, whether around the home or around the job? And so not feeling well, being anxious or stressed, turning down the fire hose. And so that helped me out. H being hungry, O being overstimulated, S standing for sleepy, and E standing for exercise. And so feel free to use that. It was on the PBS website, and it came from a parent, and I decided to use that. And they are utilizing it for helping children with anxiety and stress. And so now we are going to go into mindfulness. I absolutely love mindfulness. Ashley and I present for our school district, for the entire district. We have trainings on mindfulness and meditation. And so, just briefly, the definition of mindfulness is to be aware of the inside and the outside present, where you are right now. And so, when we show students about mindfulness, we go through the easy steps of using the five senses. What do you see? What do you smell? What do you taste? What do you hear? And what are you currently touching? And that helps to center them and bring them to the present moment. And it also says, while calmly acknowledging and accepting your feelings. And so, in being able to acknowledge and accept how you're feeling, that also means that you strive to be non-judgmental. We talked a little bit earlier about feeling and wondering, if I feel this way about a natural disaster, should I be over it by now? And for a while, I was angry with myself for still carrying that load. And then, of course, we encounter judgmental people everywhere you go. It's like, you should be over it by now. You should let that go. That happened 15 years ago. You're an adult. How can you still carry that with you? Well, I carry it with me because I'm constantly going through the stages of grief and loss. Even though, I'm still alive, I lost a lot of things and I'm still going through those stages. And I had to finally come to terms with acknowledging my feelings and accepting that they will not go away, but that I will cope with them differently, right? And so being more mindful, we want to do that in ourselves. I think it's very healthy to have a mindful practice for yourself that is comfortable for your life and your lifestyle. And then also encouraging our youth to become more mindful and finding a mindful practice that they're comfortable with and that they can actually do, right? And so that means accepting your own feelings, thoughts, bodily sensations, and using it as a therapeutic technique for healing. Okay, so does anybody have any feedback or comments about that definition so far with mindfulness? And then we're going to go into some practices. Ashley, is that correct? We can practice now? Okay. And so what I want to do really quickly is take a look at that picture with the orange, right? So I read a speech a while ago in regards to an orange. So if I am holding an orange, and I want you to tell me this in the chat, either on the app or on Zoom, if I'm holding an orange and I take that orange and I squeeze it on Ashley right now, all right, what kind of juice is going to come from that orange? Go ahead and tell me in the chat. And y'all are probably like, this lady is crazy. Tell me in the chat what kind of juice is going to come out of that orange if I squeeze it on Ashley right now. Oh, thank you so much. Y'all are quick. All right, orange juice. So, Mr. Cleveland, so I'm not going to shoot out watermelon juice, right? Or coconut juice or Aquafina, lemon, right? No other kind of juice. Orange juice is going to come out of the orange because orange juice is in the orange, right? So let me bring this home for mindfulness, because you're probably like, what in the world? Is she just hungry? I am. I want Mexican food. So orange juice is going to come out of the orange because that is what is inside of the orange. So it will definitely be liquid. I love it, Lynn. Thank you. It's going to come out of the orange because that is what's inside of the orange. So let me put myself in a pressure cooker. Tanya is going through a lot right now. That's me. Tanya's going through a lot. When I'm squeezed to my very wit's end with anxiety and stress and, oh my goodness, and systemic racism and unhealthy, situations and just feeling overwhelmed, what comes out of Tanya, whether I'm spewing horrible words or making people feel inadequate or throwing racial slurs or talking down to children and fussing at my kids, whatever comes out of me during those pressure situations was inside of me, right? And so I had to stop and think about when I heard that speech. I was like, oh my goodness. So when I say things or I hurt people and I do things that I feel maybe inadequate about after I've done them, guess what? That was a part of me. So in adding more mindful practices, I want to be a better orange so that when life puts me in the pressure cooker, I'm better at squeezing out the juices of love and compassion and listening to actually listen versus listening to respond. I want to be a better mom and a better wife and a better friend and a better coworker and a better, trauma responder and a better Zumba teacher. So I want to squeeze out all of the wonderful juices that I know are also inside of me, even when I'm in those pressure cooker situations, okay? And so that's why I put the picture of the orange there, and it just looks really pretty, and I like fruit. All right, so we're gonna go ahead and take a mindful moment. So I wish I could see everybody, but I can't. So I just have to trust that you're gonna do this with me, and I'm gonna look at Ashley do it, as well as my program director, Miss Erin Bradford, who is eavesdropping on us right now. So what we're gonna do is go ahead and sit up straight, and we're going to go ahead and drop your shoulders for me. Good. And I want you just to kind of press your chest forward a little bit and go ahead and open up those lungs, because I'm also a believer of increasing the lung capacity, making sure that we're breathing and cleansing. And you're going to go ahead and put your chin up just a little bit. And if you want to close your eyes and just listen to my voice, you can. And what I want you to do is just have your hands either by your side or on your lap, and your feet should be flat on the floor. And I want you to go ahead and you're going to breathe in deep through your nose and exhale out with your mouth. And the key when you exhale is to gently hear the breath come out of your mouth, and it should be a prolonged sigh with the exhale, okay? So let's go ahead and do that again. Breathe in deep with your nose. Exhale and sigh. Good. And we're going to take another deep breath with your nose and sigh out with your mouth. Good. And what I want you to do is to roll your shoulders back 3 times. Take it nice and easy and slow. Get a good stretch in because you deserve it. And you probably haven't done this today. Good. And let's take one more deep cleansing breath in through your nose and exhale out with your mouth. Good. And so I would love for anybody who participated with us to tell us in the chat if you enjoyed doing that and how you believe that that could be effective in working with students, or even benefiting yourself or just taking a basic body break throughout the day. So I'm going to go ahead and look for that in the chat if you enjoyed it and how or why. I'd love to see that. And so as you're telling us about it, we actually do that with students a lot, to just calm them down, have them be relaxed. And we do that with teacher populations as well when they have the training. And so I really appreciate you all doing that with us. And so I see people saying that I do this with my clients a lot to help them relax, especially those stressful ones, right? Because it's hard to dive into those conversations where you know you're going to get into something that's going to be extremely tense and extremely overwhelming. And so before you have those conversations, it's good to cleanse the air, to cleanse your body, right? To just break down those walls and open up an area of peace, because I'm sure clients and students can feel energies. They can feel when we're not settled, and it can read off into them not being as settled and as we would like for them to be. It is a great small break from stress. I enjoyed it. I felt my body relax. I was holding tension and forget to relax myself. Definitely. The whole way driving over here to the office, I'm driving with one hand on the wheel and the other hand's crunched up. And so definitely we deserve a small break, even if it is to take a breath. And so it's good just to take a moment to breathe. We deserve that. I felt less tense, if even for a short period. And so I want to comment on that, because right now, my husband and I, he's also an educator. We were talking, and he's saying that work time now, because of coronavirus, is like spilling into like personal time. So whereas we were working 8 to 10 hour days, now we're working 16 to 18-hour days, and there's no break in between, because not as many people are driving home, and people are doing telehealth, and you're on the run, and you're making sure your kids are okay. And then we seem, as professionals in what we do, we also tend to pour out more of ourselves, and we want to help more. So that means there's less time for you for self-care on the back end, right? So that's something to think about. And so I appreciate that you all are saying that felt good, and that you are feeling more relaxed, that you enjoyed it. It's difficult to know what tensions you have in your body until you take a mindful moment. That's right. Because sometimes, and that becomes the new normal, right? So sometimes we forget about ourselves. So we want to remind everybody today to take the time you need for yourself, and then also to encourage your clients and students to take that time for themselves. I actually had one student come to me to talk about an issue, and he was extremely angry. And I said, have you ever tried deep belly breathing? He was like, what in the what belly breathe? He was like, I don't belly dance in the sun. I didn't say belly dance. Have you ever tried deep belly breathing? And I was like, let's try it. You put your hands on your stomach, and I want you to take a deep breath in and hold it. And then exhale. The first time he did, he was like, this is crazy. I said, just give me 3 times. And the third time he tried it, he cried. And he said he had never experienced a moment of peace in his head. And then once he found, this is his words, once he found the peace, he was able to like let all of his emotions out. And so that actually opened the door for a deep conversation about why he was so angry all of the time. And I felt like the deep belly breathing was going to allow me the opportunity to talk to him and kind of like move out some of that anger to distract him. I use it as a distraction technique, but it actually worked for him to find peace in his head, according to his words. So maybe trying something just like the deep belly breathing. And so that goes to the first one, Ashley. Quick and easy mindfulness techniques, right? So go ahead and you can take us through that.
All right, so Tanya and I will kind of jump back and forth with these techniques, but I wanted to talk about, she talked about deep breathing, but I want to talk specifically about deep heart focused breathing. And again, I mentioned earlier the Heart Math Institute. And so that's where this kind of theory comes from, and this quick and easy technique. So we're going to practice all these techniques today because, again, you know, it's late in the afternoon. Everybody needs a little bit of fun. We think it's fun to do these techniques and kind of, you know, just take a break from just sitting at the computer on the Zoom all day like we've all been doing day after day after day. So what heart focused breathing is, like I mentioned earlier, the Heart Math Institute found that a trauma survivor's resting heart rate is higher than the average person's resting heart rate. So what heart focused breathing is all about is focusing on getting that heart rate down. So we're just going to do this exercise real quick. So what I want you to do again is just find a comfortable position, get kind of relaxed. I want you to take both of your hands and put them over your heart. And then I want you to just gently gaze down at your heart. Don't hurt yourself, get cross-eyed or anything like that. Just a gentle gaze down to your heart. And take some of those deep breaths like you just did and with your mindful moment with Tanya. A deep breath in, right? And a deep breath. I always like to explain this, especially to children, because sometimes they confuse deep breathing with quick breathing, deep breathing with like labored breathing. So I like to explain to them a deep breath is when you just breathe in. You can feel your belly grow when you take a deep breath, and then you let it out. And letting it all the way out until you can't really feel any air in there anymore. And then as we're deep breathing, and we've got our gaze focused on our heart and our hands focused on our heart. And I'm going to be quiet in just a minute and let you guys have a minute or two just to do this without my talking. But I want you to think about, really just think about your heart. Think about its function, the blood pumping through your body, giving you life. Think about the other function that we typically think of when we think of the heart, which is love, which is not the actual physical function, but that's generally what many people associate the heart with love. And so while we're taking these deep breaths, looking at our heart, physically having our hands on our heart, we're going to think about the functions of the heart. We're going to actively think about getting that heart rate down. And we're going to think about something that we love or brings love and joy to us. So I'm going to stop talking. I'm going to give you about 30 seconds to take a few deep breaths and think about those things I just told you to think about. Thank you so much for taking that moment. And when you're ready, you can lift your gaze back up. You can put your hands back into a comfortable position. And I hope you'll put in the chat how you felt about that specific technique, not just deep breathing, but deep breathing with a focus on the heart. And Tanya's going to talk a little bit about meditation, but before she does, I just wanted to mention that I also like to explain to kids when I work with them why deep breathing works. I feel like a lot of times we tell kids, take a deep breath without explaining to them the physiology behind it, and that when you take those deep breaths in, your brain actually releases more serotonin, and so that creates that good feeling, right? And it's helpful for kids to know stuff like that. And it makes them make sense. So I'm not just telling you to take a deep breath just for the sake of telling you that. I'm telling you that because physiologically, scientifically, it actually works to calm a person down. Anything in the chat, Tanya, about heart-focused breathing? I'm going to mention it before we move on.
Yes, so we have some good comments that made people feel calm, as well as smiling really big and my head fell back, and relaxing and took me to a happy and grateful place. So really good comments. I absolutely love the heart focused breathing, also from a standpoint of gratitude, right? And so I have a question in the chat, Mr. Cleveland. I'm going to go ahead and call on you. I appreciate this question because it is it's everything that we actually encounter, right? So he says, what do you do, or what can you do when it's hard to get that mindful moment? Because we're so busy, right? It's hard to say, I'm going to stop what I'm doing and actually intentionally take time for a mindful moment, especially when you have so many things going on, and sometimes it's a constant worry. So yes, I am also in a state of constant worry. Even here, I'm like, oh my goodness, is Ashley breathing too hard in my direction? Because I don't know if she has the COVID, you know. So definitely wanting to find the mindful moments. Now, I will say this: if you are beginning your mindful practice, it is unrealistic to say that you will practice active mindfulness for 30 minutes, 7 days a week. You want to set realistic goals, and we're gonna talk about this as we as professionals strive to do it. We as humans strive, as well as serving our youth. So set realistic goals, such as I will strive to have a mindful moment for 5 minutes every other day, right? And so let me give you some of my quick tips that work for me. I go to the bathroom. Believe it or not, the bathroom can be a sacred place for you to go and be in the bathroom, but really be in the bathroom for your own self-care. Taking a pillow, closing down the top to the commode, sitting there with a pillow, turning the lights off, and just deep breathing for 2 or 3 minutes. Getting in that quick mindful moment in secret, right? Because you're pretending like you're in there, but you're really just, I need a moment. Using the restroom for that. Taking your shoes off if you feel comfortable doing that, and walking through the grass. Having thoughts of gratitude, possibly keeping a journal. Ashley has been journaling for years. And so putting pen to paper can be a part of mindfulness to get some thoughts out and to relax you. Me, myself, I love doing cosmic kids yoga with my two little ones. If you haven't heard about it, it's amazing. It's on a YouTube channel, Cosmic Kids Yoga. Easy to do. And you would think doing yoga poses and stretching is so adult, right? It's just so, it's complex. It's hard to do. Downward dog, oh my goodness, my poor back. But this Cosmic Kids Yoga is fun. It's storytelling combined with yoga poses, and we'll get a little bit into that that too. Some chair yoga we can do at work. But it is amazing to see how you can customize your mindful experience. So what I will say is, it is okay if you only do 1 minute a day. We gave you about a minute, and guess what? We accomplished that goal for today. It is okay to stop and take a deep breath. Okay, it's okay to stop and take a deep breath. It is okay to admire, your hands and say, you know what? My hands are the hands that help to touch lives, and I am so thankful for the opportunity to be able to serve and being thankful in that. We're also going to jump into mantras and affirmations. And I'll tell you the difference of those. We're being able to talk to yourself and express these things for yourself, right? I think that being authentic, acknowledging and being honest, and saying what you can and cannot do for yourself is okay. I also have here using guided meditations. Ashley does not like to just sit and breathe in silence. I do. She loves guided meditations and mantras. I love silence and affirmations. So finding out what you like, trying new things, and also if you are in a home with more than one person, trying to get everybody in the house on board, right? With doing something together would be helpful. Also, I said gratitude. So what I want to do quickly, and then I'm gonna tag Ashley, and is in the chat right now. I would love to know, what are you grateful for right now? What are you grateful for right now? And I'd love if everybody would comment, because we all have something to be grateful for. What are you grateful for right now? And then I'm gonna tag Ashley back in. So I see my job. I see you, Mr. Arbery. My job, my family. For me, it is breath, being able to breathe and not have trouble breathing, right? If you knew my story, you know why, but being able to take a breath. I wish I could see you all's faces. Spending time with my family, my job and my daughter. Family, job, health. Family and safety, my health, right? So life, that's right, life. Without it, nothing else is possible. My son, my partner, a supportive circle, being able to share and love, without a doubt. Family, job, life, God's grace and mercy in our lives, stages of development. That's right, we have come a long way. Grandbabies, health, family, peace, job flexibility. That's right, family, job, friends. My supervisor allowing us to use her space as a safety precaution and to be able to present from an area with super Wi-Fi. Grateful to open my eyes each morning, because I know not everyone is awarded that opportunity, right? And so God, love, and faith. Retirement. Oh, who is retiring? Oh my goodness. Well, congratulations on your retirement. Health and life. Good job, Linda. Sanity. Yes. Oh, sanity. Okay. Mexican, Megan, you still, Megan. Are you in Baton Rouge? We can go to La Coretta's, and the queso is amazing. Mexican food. All right. And so y'all, just being able to say and actually put it out there, I'm grateful for this. Doesn't that feel good? It feels good. We are in a time where we have been cooped up with the same people for weeks and we are still expected to work, right? And not that we don't want to, we love what we do. If we didn't love what we do, we'd be in a different profession. We are givers by nature, right? We are on a 3-hour conference session because we love what we do, right? But we also have to find the time to say, you know what, this is stressful and I need to charge my battery, and it is okay. Same thing to encourage our youth. And so, clothed in my right mind reasonably. Linda, so you're clothed in your right mind reasonably. And we really appreciate you all. And someone else said God, family, and health. And I am going to find you, Megan, and we're going to go to La Coretta's and have queso. Okay, and so Ashley wanted to tag in.
Yeah, thank you, Tanya. I did want to tag in because Mr. Cleveland, I think you said his name was, Tanya, in the chat, said looking for that mindful moment. And I just wanted to, Tanya mentioned the bathroom, which was my first thought, because I can't even hide in the bathroom at my own house because my 2 little ones are just following me in there. But at the office, the workplace, hopefully no one is following you in there. So that is a great place to go, just kind of take a break for a minute. I wanted to mention the car as well, because it's something you might not really think about, but we go, not currently because of the COVID situation, but normally we travel between schools. So, and even in your own car, if you go to, to and from work every day, taking just 2 or 3 minutes before you get out of that car, or when you get into the car, to just take a deep breath and release everything from where you just came from. Sometimes work can be more stressful than home. Sometimes home is more stressful than work, depending on your life situation. So wherever you are leaving, and whenever you get there, taking a few extra minutes in the car by yourself to take a few deep breaths, and to, think on gratitude for a minute is a great idea. Now, Tanya talked about meditation as, really, when we think of meditation, we think of kind of emptying our minds and just sitting with that. I have a very hard time with that, like she mentioned, because when I stop and am still, then things start to creep in. What am I going to cook for dinner tomorrow night? Who's bringing the boys to their mama's house the next day when I have a presentation to do? Why did I say that embarrassing thing in the 7th grade in front of all my friends? Those kind of things creep into my head when I'm sitting in silence. So that's why for meditation, the next bullet point is mantras. And Tanya will talk about affirmations after I talk about mantras. But what a mantra is, the first time I ever heard that word, I had no idea what it was. But a mantra is just a phrase or a statement that you repeat, or a word even, that you repeat. That is helpful to me, because if I'm not occupying my mind with something, then like I said, those thoughts creep in. So I'll give you an example of my favorite one that I share all the time. I oftentimes have trouble going to sleep at night, and it's because of all those creeping and lingering thoughts. And so over and over, I will say to myself, I am peaceful, I am calm, I'm ready for sleep. That's a mantra. That's a good example of a mantra. So if I'm constantly repeating, I am peaceful, I am calm, I am ready for sleep, then my brain is occupied on that repetition, and it's not allowing all those intrusive thoughts to come in. So that's why my mantras can be very helpful if you have a hard time meditating and just like taking a peaceful silent moment. A mantra can help you do that. An affirmation is similar. Do you want to talk about that, Tanya? You want me to keep going?
Okay, so we have a break.
Oh, do we have another break?
Mm-hmm. Let's go ahead and give an example of another mantra for me.
Okay, so an example, well, I'll say an affirmation is very much like a mantra, but an affirmation has a positive spin on it. So a mantra might be, do you guys, I don't know if any of you are Saturday Night Live watchers, but they're on Saturday Night Live, they used to have that character, Stuart Smalley, who would look in the mirror and say, I am good enough, I am smart enough, people like me. That's a mantra. You have to psych yourself up. I am a good enough person, I am a smart enough person. I have the ability to make change in the world. So, when we go into these difficult situations where we're working with students and with children who have experienced trauma, a good mantra for us to say over and over again is, I can make a difference. I can make a difference. When you feel like you're not making that big of a difference, that every little thing you do is making a difference. So that's a good mantra. And an affirmation is the same thing. It just has a positive spin on it. So we use these with our students a lot in goal setting. So if you have a student, for example, who has a lot of anxiety, their affirmation could be, I can get through this. That's very simple, right? An affirmation might be, I am strong enough to get through this. An affirmation could be, I have, right, that was a good, Tanya sitting across the table from me. I will be my best self today is an affirmation. We use this a lot with kids so they can kind of build themselves up, and it works with resiliency, which we'll talk about later too. Tanya mentioned that we had a break, so.
Have a break from 3:30 to 3:45.
Okay, and I think we're taking breaks because we took, because this is such a long um, presentation. So we've been informed by the organizers that we're taking a break. So at 3:45, we'll come back and we'll continue with these techniques, and we'll talk about some other practical techniques.
I want to give quick homework. Okay, y'all, before we take the break for me, I'm gonna give you a little break homework really quick, a ticket out of the door, if you will. Go ahead and put for me either in the chat or on the app an affirmation for yourself. I will, I can, I am. And let me see something. I will. So for me, I will meet Megan for that queso at some point. Okay, that's my example. But I will be my very best self for my children this weekend because they need me. I am absolutely amazing at everything I do, even though I may make mistakes. And the power of yet. I have not done 5 burpees yet, but I will. So just using that type of language is so important. And I want you to go ahead and put something either related to an affirmation or a mantra in the chat, and then feel free to take your break. And we'll see you back at 3:45. Thank you.
All right, welcome back, everybody. Hope everyone had a nice break again. We know these 3-hour presentations are a lot to sit through, so we hope you had an opportunity to get up and stretch. Tanya, we're going to finish up these quick and easy mindfulness techniques, and just want to remind everybody that these are techniques that will hope you'll use. They're quick and easy to use with the kids that you're working with, and also for yourself. So Tanya's going to take us through the bell sound activity.
Yes, and so just remembering that we are recognizing and responding to trauma. And so these activities will assist you in responding to the trauma. I do want to acknowledge the wonderful mantras and affirmations in the chat, Ashley. And so I wanted to read a few. I will be my best with my family and others. I will have a peaceful day. I am confident that I can do this work and take care of myself. That's two separate things. And yes, being confident, Claudette, that you can do that. You will take the time to breathe. I will put my best effort in all I do. Megan, my new friend, says I can control myself and only eat one bowl of queso when I meet Tanya. Yes, Megan, yes, I am worthy. And then also on the app, we have I will stay focused on the task at hand or the person in front of me, right? Not allowing distractions to pull you away from the tasks at hand. I will exercise one day this week. I am a victor and not a victim. Very good. I can do all things through Christ who strengthens me, and I'm sorry. I am working towards achieving my goals. I will accomplish them. I am uniquely and wonderfully made and loved by God. And I think when you come up with affirmations and mantras, making sure that you use voice inflection the way our third graders are taught to read, like freckle juice, right? So, I have a third grader who's reading freckle juice, and they're like, oh, the freckles were on her face. Oh my, they're taught to use those inflections so that you can get a better read out of the literature. Same thing with the mantras and affirmations. I will be more mindful of the use of my time versus I will be more mindful of the use of my time. You can feel the difference. So making sure that you're saying them to yourself with that power behind it. Live, love, laugh. I will accomplish my goals. I will continue to work on my faults, not for others, but for myself. That's right. The power of yet. I am fearfully and wonderfully made. I am well provided for. I am in divine alignment and right where I need to be. Thank you, Jamie. I will accomplish my goals and be better for me and my kids. I am strong. I am beautiful. I am one of a kind. Yes, you are. I will make it through my senior year. This too shall pass. Yes. And so I am patient, caring, loving, and love to help people. I will make sure that I take time for myself and relax. I am blessed. I am capable. I am who I say I am. That's right. I can. I will enjoy my abundance, life's blessings. I will stay focused on my tasks. And so I think that that is absolutely amazing. Cleveland, I'm gonna go back to you because you talked about plugging in those mindful moments. We did that, and that was 10 seconds of your time to tell yourself that you are absolutely amazing. And actually looking at that and seeing it not just in your head, but also on a piece of paper, on your phone, on the computer, taking time to do that is so essential. So I appreciate you all doing that for your ticket out of the door for your break and welcoming back. And so we're going to go ahead and take a look at the bell sound. And so with the bell sound, and if you saw my supervisor coming behind Ashley, she's amazing. She just brought us a fresh cup of hot coffee. So we feel greatly appreciated. Erin Bradford, Program Director for the Eye Care Program, thank you. So with the bell sound, when you are doing meditation or mindfulness, you can use not only guided meditations, but also, thank you, also items around the home or your office or your classroom, right? And so here we have a bell that we got from Yoga for Kids. It was a training we attended. It was amazing. Yoga for Kids, and it helps to educate teachers and educators on how to practice more mindfulness and yoga in the classroom, right? And so it's a simple bell. At my house, I actually have kind of like it's a Yeti cup. Don't judge me. It's a Yeti cup and a fork. And I actually take it and I turn the fork instead of like this, I turn it sideways and I hit it, and it makes just a great sound, something about the Yeti. Again, ding. And my kids know that when I hit that, it is time to kind of like center and reset. So what I want to do now is hit this bell, and if you can hear it, I want you to type yes. Everybody can hear it? Okay, great. Ashley's saying yes, but she's in the room with me. I want to know if you can hear it. Okay, great. Thank you all. Thank you. Y'all type yes so fast. Okay, great. And so what happens with the bell is it kind of has a lasting effect, right? If you hit it a certain way, all right, versus, you hear that, right? And so using things that you may have around your home, office, classroom can help to reset a student, right? So if I want to get all of my students' attention without saying, hey, let me come in, pay attention, that is an aggressive way, and that may not work for students who are actively going through trauma or who have gone through trauma situations at home where they've been yelled at or snapped at or whatever's going on with them. That may not get their attention the right way. And so in using the bell sound, you use the bell, and what you can do is students can hear the bell, take a deep breath in and exhale in the moment, or you can use the bell as a focal point. So for the participants who know that when you meditate or take a deep breath, that silence is not quite what you need, you may want to use an instrument. There are YouTube videos that have the bell sound, and it's a lasting sound. So for as long as you hear the sound projected, you keep your eyes closed and you deep breathe. And then when you hear the sound end, you can open your eyes, right? So let's go ahead and try that method together now, if you don't mind. I'm going to hit the bell, and for as long as you hear the sound, put it near my earpiece. As long as you hear the sound, I want you to keep your eyes closed. And I don't know what you're doing because I can't see you, but I'm going to see if I can feel you do it, okay? Everybody go ahead and close your eyes for me now. And when you hear it, take a deep breath. And when you hear the sound end, I want you to open your eyes. Okay, and I'll do it one more time. And that one was a little bit longer. And so the bell sound is interesting. I initially thought it would only be a good tool for littles, like maybe third grade and under, but I found that even my high schoolers respond to the bell sound even virtually. So in virtual sessions, in virtual teaching, hitting the bell, they see me pull it out and they're like, uh-oh, let me stop and take a breath, right? And so it's a really, really good tool to use. And so Ashley, would you like to give some feedback on the bell sound? And if you all like that technique, let me know.
Yeah, the bell sound is great. The first time I used it, I was uncertain about it also, but what I found was it works just like a mantra, because if you're focused on hearing that sound, then you're not thinking of anything else. Those other thoughts are not able to creep in because you're so focused on, am I still listening to that sound? So that's what I like about the bell sound. We're going to do one more quick and easy mindfulness technique, which is progressive muscle relaxation. And so I hope you'll all participate and don't fall asleep on us with this one, because it is very relaxing. But it's something that you can do. It's something that you can do very quickly when you need a quick break, but it's also something you can really stretch out and do like before bed, to get a really deep sense of relaxation and calmness. So what progressive muscle relaxation is progressively, purposefully tensing and then relaxing each muscle in your body. And one of the reasons I like this so much is that, like for me, I carry my attention in my neck and shoulders. And so sometimes I will be walking around with my shoulders like this, all tensed up, not even realizing it. And so when you take a second to really focus on the tension and the release, then it can just really help you relax and not carry all that stress. So we'll do a quick version of this. So I want everybody to get into just kind of a comfortable position. I'm going to do it with you guys. So get into a comfortable position. And we'll go from head to toe, and we're going to do progressive muscle relaxation. So as we're doing this, just take some deep breaths. If you'd like to close your eyes, I can kind of help you relax too. And so we're going to start with our face, and I want you to tense the muscles in your face. If you don't know how to do that, you just kind of scrunch your face up like this. Hold it, and then relax those muscles. Take a deep breath in between each group. So take a deep breath. Now we're going to go to our shoulders. I want you to tense your shoulders. So you can do that by lifting them up to your ears. Hold that for just a moment and then release. You can really feel how much better it feels when you're able to release that and the difference between the release and the tension. Take another deep breath. We're going to do our biceps and forearms. So you can do that by kind of like clenching your fists, making muscles like a muscle man. So clench your fists up and do those muscles. I don't have very many muscles up here. Do it anyway. Take a deep breath and on exhale, let it out. We're going to move down to our stomach. You can clench your abs tight by kind of hunching over. Hold that for a second. On the exhale, release that. We're going to do our booty muscles, which always makes our kids giggle, and sometimes the adults giggle too. But you do that, you know, just clench them together. Lift up in your seat. Deep breath in, deep breath out and release. We'll do our leg muscles. We'll do the whole leg at once, and you could do this by flexing your toes and kind of lifting your legs off the ground and flex your toes. Hold it in as you exhale, inhale, and release as you exhale. And then finally, we'll move all the way down to our feet. I'm going to take my feet out of my sandals down here so I can do this. So you can clench your feet up by curling your toes and really squeezing your feet. And when you exhale, release. So we just did a quick progressive muscle relaxation, the whole body, head to toe, took about 2 minutes, and it's so very relaxing. So I hope you feel more relaxed after that and can see the effectiveness of how that can be used as mindful. And again, it's quick and easy to do for yourself. It's a quick and easy technique to teach any kids that you work with. So if you have any thoughts about that, again, please put them in the chat. We are going to move on from these quick and easy mindfulness techniques to practical applications to responding to children. So all of these practical applications that we're going to talk about are grounded in the theories that we talked about earlier. They're grounded in TBRI, grounded in emotional intelligence, and in mindfulness. And I did see that in the chat, somebody mentioned that Crossroads New Orleans does a TBRI training, which is exactly right, which is where I learned about TBRI. I went to one of their weekend-long trainings back before COVID, multiple days, but now they do a series online and it's awesome. So I agree, whoever put that comment, thank you for that, and encourage everybody to sign up for that, Crossroads New Orleans. So responding to children, practical applications. So one way to help children deal with trauma is to create an environment that helps them deal with trauma. So creating a calm, structured environment, not only at home, but also at school. So in our work, we work with educators. We try to teach them to create the classroom and school culture that is calm and structured. You can do this for parents of the children that you work with too. Develop and maintain routines. We did this presentation, a shortened version of this presentation a couple of days ago, and Tanya added in there boundaries, setting boundaries, which is what calm environment and maintaining routines is all about. When a child has routines and they're stuck to, then they know what the expectations are. They know what to expect. It doesn't leave any room for what ifs. And so that creates a safety net, a sense of safety for them, which is definitely what a child who has experienced trauma needs. They need that sense of safety. Pay attention and talking about feelings. So not only the child's feelings, but your own. Whenever you see a child having a reaction, an emotional reaction, acknowledge that, talk about it. What's going on with you? Why are you feeling that way? Helping them name feelings. We have this little feelings chart on here because it covers a wide variety of feelings. You know, kids know the three, right? Mad, glad, sad. They're either mad, glad, or sad. And there's a lot more that goes into that. Oftentimes we find when a kid is mad, they're really embarrassed about something, or afraid about something, or worried about something, which brings out the anger. So helping them identify those feelings and be able to talk about them can be very helpful for them. Having realistic expectations. Tanya talked about that a little bit earlier when she talked about having realistic expectations for yourself in terms of mindfulness and setting up a mindfulness practice, but also having realistic expectations for children who have experienced trauma. Let's use the natural disaster as an example. If they have been through a horrible storm and the results were something like Hurricane Katrina, then they're going to be anxious and nervous when a storm comes around. So allowing them to do that and not expecting them to just like jump back and pop back out of it is very important for them, because if you have realistic expectations for them, then you will be able to give them a little bit more leeway and really help them to cope with what they're going through. Again, I mean, I know you've heard us say mindfulness over and over again, but it's so important. And one of the reasons is because it brings the focus to the present. So if a child has experienced trauma, then they're often focused on the past, what happened in the past, because that's when the trauma occurred, or they might be worried about what's going to happen in the future. You know, again, with the maybe domestic violence example, mommy, daddy got in a really bad fight last night. I'm worried that they're going to get in a really bad fight again when I get home. So mindfulness is what's happening right now. Right now, you're here in my office. You're safe in this moment. So that can be very helpful to a child who has experienced trauma. Model acknowledging emotions. This is so important, especially for parents. I know that we have a mixed audience today, educators, clinicians, doctors. So a lot of the work you may not be doing directly with a child, but with a parent. So parents have to know that they are the number one role model for a child, and they've got to learn how to do all these things for themselves too, in order to model it for their children. So, and Tanya talked about this example a few days ago when we did this presentation. I'll talk about it too. We've talked about doing this with our own kids. It's okay for you to, I'm a human being too. So of course I've had times when my 9-year-old has made me, really angry, and I've maybe yelled at him too loud or too much or said something too harsh. And it's okay to say, hey, I overreacted there. I was really upset because of what happened. I should have taken a deep breath. I should have walked away. I should have done this. And modeling that for them, that it's okay to experience those emotions, be overwhelmed by those emotions sometimes, and then to kind of recognize it and learn from it and come back. Practicing healthy living is another practical application. Again, we know that trauma can affect stress and can affect the physical being of a person. So making sure that you get enough sleep at night, that you're eating healthy, that you get exercise to take care of those physical needs, that will help when the stress creates even more physical demands on your body. So that's why practicing healthy living is important. Tanya, have a chat or want to chime in?
Yes. So I want to chime in and piggyback on what Ashley said. So some quick tips on being a positive parent and a positive professional is to be authentic, to make sure that we are being true to ourselves when we're having these conversations with students and our kiddos, because they can see if we are really in tune to what they're saying, if we really genuinely care, or if we don't really care, we're just doing it because we feel like we have to, right? So being authentic. Also, to apologize, like you said in talking to Leo, and for my Layla is the one where I'm like, help me. And it is okay to apologize even as an adult, to admit our faults and say, you know, I am sorry that I did this, or I said this way. I could have done this better. So actually modeling and apologizing is very healthy to build these relationships. Also, scheduling special time for your own kids if you're extremely busy. And as in the professional world, if you're in a group setting, acknowledging individuals as well as the group is very important. And then for people in your home, what's going on now is hug time. And so we shared this in our presentation earlier, but it says that hugs are very essential to student developmental growth, right? So our little ones are no longer able to engage safely with physical challenges right now. Their social engagement is limited. And so 4 hugs is for survival. It says 8 hugs is for maintenance, and then 12 hugs for a small child enables their growth, the way that they need to grow socially, physically, and emotionally. So just remember that with the little ones, that you are able to hug safely. Make sure that you are giving them attention, whether it's a hug or whether it's eye-to-eye contact, active listening, that you are acknowledging the special things about them. And even in the professional setting, doing those same types of things. And so we just want to remind you all that when we're talking to the kids and students about in responding to them, reminding them that they are strong, that they are good kids that have had bad things happen to them, that people genuinely care about them, and that it's not their fault that these things are occurring, and that they can be resilient. Okay. Okay. Let's see. So we have some here. So thank you so much. Regina says feelings of each group member. That's right. Acknowledging the individuals in each group, not just the whole group. And then what do you do if you don't have kids, but you have 1,000,001 things to do? That is right. So I highly recommend writing things out and scheduling things in for yourself, and for the things that you need to get done, the same way you put a doctor's appointment on a calendar, the same way that you would put that you have a meeting or you have a test or whatever. You schedule in that time for yourself and make that a priority. So a key is to be intentional and to prioritize yourself the way you do other things and other people, because we are under a lot of stress and a lot of different situations that we've never encountered. So imagine our little people who are not able to communicate that as well. So make sure that you're scheduling time for yourself the way you do for other things. All right, and let me see, I think we have one more. Oh, okay, good. I appreciate that, Sandra. I hope you all are enjoying it the way I'm going to enjoy that queso.
We may or may not be hungry in here. Okay, we're going to talk about some more practical applications. So I think that somebody just said this too. Remember that different children respond differently. So, and we talk about this a lot in the school setting, because you have groups of siblings that attend the same school that are very different, that have been through a similar situation because they live in the same household, but their responses are totally different. And the reasons behind that, one is because there are stages of development. And so we know that a trauma affects people differently depending on the stage of development. And then they're just, individuals are just different, right? Your individual characteristics make you different. And so every kid responds differently. Somebody mentioned earlier in the chat too, this just made me think about it, about wondering if we as the caregivers, practitioners, educators, if sometimes we overreact and maybe a child is not as traumatized as we think they should be by an event, which is a great point and kind of goes to this point also. And let them be the guide. And that comment was spot on, because they may not be. Maybe we'll talk about resiliency in a minute. And if a child has a very good support system and has those individual characteristics that allow them to be more resilient and then have learned resiliency skills, then yeah, they may be pretty capable of getting through a traumatic situation without too many problems associated with it. So that was a very good point that you made. Communication is key with kids. Again, this goes back to that trust-based relationship. So communicating with them all the time, not just when they're having a problem, and not just when they're having when they come to you for help or when they're getting into some kind of trouble, but all the time. I used this example the other day with my son. He's 9 years old and he loves to play Fortnite. So if you have a young boy at home, I'm sure you know what I'm talking about. If you don't, it's a video game. I could care less about Fortnite, but he wants to talk about it. He wants to tell me about it. He wants to show me the game. And so we talk about it because it's important to him. And so talking about those kind of things on a day-to-day basis establishes that healthy communication. So when something does come up, he's going to know that I listen to him. And it's the same way for the kids that you work with, listening to them about things that, you know, maybe aren't of that utmost importance, but it just shows that you're listening and you're willing to listen and you care about what they have to say. Being patient. We know kids who have experienced trauma are going to have setbacks. So if they're making a lot of progress and then they fall back into some of their old habits, it's okay. Be patient with them. Staying calm. It's important for us to stay calm as the adult and as the caregiver. Again, that's with modeling that for them, making sure that we don't overreact. And so sometimes if we do overreact or don't stay calm, they can internalize that and feel like they did something wrong. And that's why we want to make sure we stay calm, because it's important not to, we don't want to re-traumatize them with our reactions. Minimizing media exposure deals with trauma that is in the media. So like in the case of the ongoing violence right now, with the mistreatment of Black males and the killing of Black males by the police, that's, you know, that's a lot to deal with, and we're seeing it we're seeing the riots and everything on the news all the time. It can be a lot. The same with the storms, the hurricanes, the same with the pandemic, the COVID. You know, we watch the news and all these things are on the news. I am very guilty of, especially at the beginning of the pandemic, like I was watching it all the time, like what's happening, how many people today, oh my God, kind of freaking out. And you got to minimize that, because not only for yourself, it can just be like the constant flooding of that ups your stress level. So minimize your own media exposure, take care to minimize your kids' media exposure as well. Try not to take things personally. So kids are going to have reactions. They're going to sometimes take out their aggression on you. Again, because sometimes kids don't have the language to express how they feel, so they do it with behavior. So don't take it personally. I saw a great graphic the other day, and it was a teacher who had her computer set up and she had a little sticky note on it. She obviously had a little kid in her class who was having a lot of behavior problems, and she had a little sticky note on her computer that said, "He's not giving you a hard time, he's having a hard time." And I just thought that was so powerful and so awesome, because she had taken that, and it seemed like maybe she had been taking it personally at some point, like, oh, why is this kid giving me such a hard time all the time? But they're not. It's not about you. It's about what's happened to them, and they're just dealing with it the best they can. So don't take it personally. Celebrate small victories and give them opportunities for small victories. Tanya mentioned the other day, she had her little girls go pick out a bow to go with your outfit. That's something easy that they can do. And when they do it, she can praise them and congratulate you. Look what you did. You picked out a bow to go with your outfit. So celebrating those little achievements that they make, laying the praise on thick for any little thing that they do positive, so that we can build up confidence and resiliency. And then promoting resiliency and self-care, and we'll talk about that in the next couple of slides. So let's see, do we have any questions in the chat, Tanya, before we move on? Okay, you want to talk about resilience?
Yes. So I'm over here getting a little bit emotional. I'm an emotional person already, but when Ashley did the sticky note, I didn't know that story. That is new for me today, so it kind of overwhelmed me just to remember that our kiddos, we see them behind the screens right now, in Baton Rouge, we're getting ready to go back to school. And so to know that some of them have been home without their needs being met. And we have big responsibilities to make sure that our students are given the tools to cope appropriately, as well as knowing that they could possibly be in active trauma is so overwhelming. But we are considered one of those major protective factors. So we are jumping into resilience, which simply means to be able to bounce back. The capacity to recover quickly from difficulties or adversity, the ability to overcome challenges, as well as it being an individual trait, but we are quickly learning that it is a necessity for it to be a community trait for community healing as well. And so, resilience has been a word that has been around for quite some time, but I'm hearing a lot of people use the word resilience now because we are having to bounce back quicker and with more and more things going on. And so in being resilient, we want to encourage students to know the definition, to be able to bounce back. And when you say bounce back to the students, they know exactly what that means, whether it's in music or whether it's in sports. We talk about basketball, using the ball, bouncing the ball back and forth, rebounding for resilience is key. And so just using that. And so I love this particular graphic that Ashley picked out with the flower going through the crack. And so my mom, I love her to pieces. She has always said that Katrina helped to form who we are. And I use that a lot, right? So I'm still going through what I go through, and that's okay. A flower has to grow through dirt. And so that is her example for my life's challenges. Many things have happened to me over time. I lost my father due to living in the trailers with Katrina. And so I still take that very hard. And family members were lost. And so it's just a lot of different things that I have to remember when I start to have the feelings of feeling overwhelmed and grief. And I have to remember that all flowers go through the dirt. And so being able to reframe those thoughts into an area that can be healthy and that I can cope safely has been a major feat for me, right? Trying to continue the resilience. It's not something that you get one day and then you have it forever. You have to continuously work on being resilient, especially when new challenges come in. Same thing for our students. New challenges come every day. Same thing for us as adults. What's interesting is when we talked about taking the brain break, being mindful and taking a deep breath, over 100 of us said, whew, I really needed that today. That's interesting. That is amazing. And that is needed because we are the population that are serving the rest of the population that's going through trauma, right? So we need to make sure that we are constantly working on ourselves, constantly striving to be resilient, and also offering up our knowledge and our skills to the youth that we serve, okay? Do we have any comments or questions about resiliency or resilience or any feedback? Okay. All right, so building resiliency in children, we want to set small, achievable goals. We talked about that earlier with being intentional, but also setting goals that we know our students can reach, right? Building confidence with praise, such as, you are strong. You are an overcomer. You are a victor. You are a good kid, and bad things are happening, and I acknowledge that, right? Being encouraging, positive thinking. So I had this conversation with my little ones. I can't do that. No. We're going to start changing the words around because just you saying I can't, now that we're in the home 24 hours a day, every time she says the word can't, she would start to cry. I can't. And I'm like, oh my goodness, I can't. But I had to stop and think and say, right now you are not able to tie your shoe, but you will. Right now you may not be able to, write in script, but you will, right? And so encouraging the positive thinking, and then by reframing our word choices, we're able to do that for ourselves as well. And that feels so much better. Mentoring and being a role model. Ashley talked earlier about modeling the behavior that we expect from our youth across the board, modeling the behavior that we expect from our coworkers and our colleagues, right? I want to be supported and nourished, and I want to be somebody who shows that to others. Having strong relationships. We talk a lot about relational education, and right now it is key that we continue to build relationships individually, in our homes, and with our community. Community-wide healing is going to be needed for our kids, because we have all types of racial backgrounds, we have all types of ethnicities or religious backgrounds. Everybody should be respected, nourished, cared about, loved, and feel that same. We should be okay with having these types of conversations for collective healing. Okay. Problem solving skills, being able to say, I find a problem and there's a solution. I think we all can attest to, in our adult world, in encountering adults who always have problems. Okay. So if I need to know in the chat box, if you have colleagues or family members, or people who you encounter in your adult world, where every time you have an idea or you want to bring up a topic, they may say, well, see, the problem with that is, and if you do, say yes in the chat and tell me how that makes you feel when you hear that, because I'm interested to know. I'm doing soft data collection now. So if anybody has a colleague, a family member, an adult friend, every time you bring something up, for instance, I want to meet Megan to eat the queso. Well, see, the problem with that is, Tanya, the queso has 30,000 calories in it, right? And so what we want to do is be solution finders. We want to assist with the problem solving skills. And maybe being a solution finder isn't right as in the professional world. It's not our jobs to fix everything. That's me as a mom. But I love it. Okay, so Megan she caught it. Thank you, Megan. She said, Tanya, we could eat salsa instead. She fixed it. She fixed the problem with the 30,000 calories in the queso. We can eat salsa and still be together. We want to be solution based, right? And we want to encourage our students to have that same thought. Okay, and so Christina said, this is why it's good to not give suggestions or advice, but to ask the person for, thank you, Christina, but to ask the person for the solutions. And so Megan fell into my trap. Megan, I think you're my sister from another mister. She found it and she said, we can eat salsa. And so in the chat, this is why it's good to not give suggestions or advice, but to ask the person what solutions they can think of. And Shai says, well, I tend to use it and try to make sure that I am looking at varied angles of the issue, all while giving input and options. Yes. And so just making sure that we are open-minded and modeling the behavior of open-mindedness with them as well. Letting them know that it is okay to ask for help. And us as the professionals, it's okay to ask for help. Having the growth mindset like we talked about, and also modeling their resiliency. So I appreciate you all giving that feedback for me. And so we're going to go on to the next slide.
Yeah, and I just want to say about resiliency before we do go to the next slide, where we're going to talk about self-care, that there is a false kind of belief that resiliency is something that some people are born with, and resiliency is a skill, and it can be taught. And children can learn to be resilient. If they're not already resilient, then they can learn to be. They can definitely, having a strong support system, having more protective factors in place are all things that assist with resiliency, but it can also be taught. And all the things that we have here that Tanya just went over are the things we can help do for children to teach them how to be more resilient. And then when they learn how to be more resilient, they can be better at navigating through a trauma, which is what, I didn't catch the name of the person who said it, Tanya, but the person who said that's why we should avoid advice giving and teach them how to problem solve on their own is exactly right. Because the other thing is too, it goes back to a point we made earlier, everybody's different, everybody deals with situations differently. What may be a solution for me may not be a solution for my student that I'm working with. And if you help them figure out a problem and solve a problem instead of trying to solve it for them, then you equip them with those skills to allow them to be able to solve problems on their own in the future. So great points you guys made in the chat. Please please keep them coming, because we're going to talk about self-care next. And we talk about self-care for a couple of reasons. Number one, it's an important skill to teach to kids as well. Self-care is one of the things that you can teach students and children to do in order to help them cope with a traumatic event. It's one of those things, again, it helps build resiliency. It's going to help them to be able to navigate trauma in the future. So it's important for that. And number two, it's important for us. All of you who are here today, Tanya and I, like she said, we're in this field because we're caring people. We're fixers. We want to fix things. We want to help people. We're caring and nurturing people. And sometimes that can wear you out because you care a lot so much that that it wears you out. And so it's very important to take care of yourself. You cannot give fully to the people that you are trying to serve if you are not taken care of, if you're not well yourself. So when we talk about self-care, we talk about purposefully taking care of yourself and your own well-being. I think a lot of people, and for me, I know a lot at the very beginning when I first started hearing about self-care, because when I was a teacher, self-care was not a term that was ever used. I don't remember this term at all, not until I became a counselor and then a specialist. But so it's not just about eating right and exercising, right? That's what I think about first when I think about taking care of yourself. No, it's about taking care of all those needs. And so that's why we put up this self-care wheel, because it kind of covers all of the different areas of your life that you may need to engage in self-care. So your personal life, your spiritual life, your professional life. I know that my husband for a short time worked at a job that he absolutely hated. And it was evident, it definitely affected his personality at home. Luckily, it didn't last that long. He wasn't in that job for very long. But, if you're not happy professionally and taking care of yourself professionally, that's going to affect all these other areas of your life also. So just taking care of all these areas is important. Don't just think of one of these segments as self-care. And then we always like to mention also putting your mask on first as a great way to think of self-care. I think there's another graphic coming up too about having your cup full. But when you ride on an airplane and the stewardess tells you at the beginning, when the masks drop down, if the masks drop down, hopefully they don't, but if they do, and you have to, there's a situation like that, before you help anybody else, you have to put your mask on first. So, because if you don't, you will run out of oxygen before you can help your neighbor. And the same theory holds true here. Take care of yourself first, or you won't be able to take care of others. It's really that simple. That's kind of the methodology behind self-care. Tanya would like to be tagged in.
Okay. All right. And so, okay. So earlier we asked, what is some things you can do to better your self-care within 4 areas? I think we did professional, physical, emotional, and spiritual. So I want to take a look at psychological and personal right now on the self-care wheel. And I also want to point out that in the middle, it says life balance, right? So if I am a Zumba teacher and line dance and I like a lot of fitness things, I might just focus on the self-care area that I am used to or comfortable with, right? And so that can kind of create an imbalance if I neglect all the other areas. So what I want us to do now is take a look at the psychological category as well as personal, and pick one of those two and tell me, what can you commit to doing more for yourself in which category, either the psychological or the personal, and let us know which area can you commit to doing more in, and what can you do from that list. And go ahead, I'm gonna say like my 8-year-old says, go ahead and click that like button and click subscribe, smash that chat box and put your chat in there. And if you watch any YouTube videos with kids, you know what I'm talking about. So go ahead and put that in for me. And we're gonna read some of those out. And thank you all to the over 120 people for sticking with us to the end. We promise you'll still be able to have some more mindfulness techniques at the end that will be relaxing and rewarding. So hang in there with us. Still waiting in the chat, either the psychological category or the personal category, and tell us what you can commit to doing more of, even if it's once a week. Thank you, Linda. She says self-reflection and journaling. So that is in the psychological category. So thank you. All right. Anybody else? I'll give away a free deep breath to the next 5 people that can put that inside of the chat. Okay. Oh, okay. You get the look at y'all get the free deep breath on the app. So self-reflecting, making a vision board. That's a beautiful idea. I need to do that this weekend. I didn't think about that. So thank you, Carla. Practice asking for help and receiving help. That's a good one because I'll ask and then I was like, I'm good. No, asking and receiving, reaching out to friends more regularly, checking on our friends because it is okay not to be okay, and many of us are not okay. Drawing and painting, very therapeutic. My friend Erin is an artist and she is amazing at art. So I'm going to reach out to her for some artistic help. Coloring, meditating, yes. Thinking of your own positive qualities. I like that, Cleveland. Thinking of your own positive qualities. Okay. Let's see. Practice saying no. Yes, Lakanga, saying no. Honoring your own time. Yes, I just had this conversation. Saying no. Getting coffee with a friend. Guess what? Ashley and I are having coffee at 5 o'clock in the afternoon. All right. Eating healthy and exercising. And yes, okay, so Anisha, you're with Kathleen saying asking for help and accepting it. Because how many of us are professionals that we'll say, I got it, we have it. We don't need assistance, but we all need a little help. And it is okay to ask and receive. And let me look on Zoom. Practicing and receiving and asking. Um, Personal, getting out of debt, and fostering more friendships. Yes, and not just any kind of friendships, Cynthia, healthy friendships, right? People that pour into you and you can pour into them and it's reciprocal. Catching up on reading besides mental health reading, yes. Oh, Claudette, you like James Patterson. Ah, so good deep reads, right? Some good noveling. All right, so good. So just picking out just a few things from that psychological category and the personal category, because again, we spend so much on others that we neglect ourselves, and it could be easy to do that because we're used to being on that hamster wheel, go, go, go. So it is okay to take that time. And so you all just committed to me and Ashley that you all are gonna strive to do more for yourself, meditating, exercising, yoga, positive affirmations, and saying no. So I will say publicly to you all that I am committing to saying no more and honoring the time that I gain from saying no. That's deep. I'm gonna honor my time when I say no and stick to it. So thank you all for that. Ashley, do you want to commit to one? You get a free deep breath. Thank you. You're welcome.
Yes, I will also to commit to getting more coffee with friends. Really the one that I want to do. But I also want to say that this wheel itself is a great tool to use because you can, just like Tanya did with you all, show you the wheel, have you pick out something that you know you can do that's realistic for you to do. You know, like for example, acupuncture is on here. I'm not going to get acupuncture. I mean, I would love to, but I don't see it happening, you know. I'm not going to do it, but I might, bubble bath might be something that is within my reach, something that I could do for myself. So allowing your kids to take a look at this and think of some ideas that maybe they never thought of before that would help them to take care of themselves. So this will be a great tool for that. One more tool that we want to give you for self-care are the control circles. Ty and I love these control circles, and I use these with almost every student that I see because I love them so much and I just think they're so effective. And I wrote down, I was looking at the chat just a minute ago, I wrote down, someone named Thomas in the chat said, helping their students or clients or kids come up with solutions that are realistic because sometimes they come up with solutions that are out of their control, was his comment, which is perfect. And this is exactly what that is for. So we found these effective for a couple of reasons. One is the one that Thomas mentioned. A lot of times, I'll give the example of some of the teenagers that I work with in middle school. A lot of times, a lot of their grief is coming from other students, other kids talking about them, picking with them, that kind of thing. So it is very effective for us to establish that you cannot control those other kids. You can't control what they say about you, how they feel about you. You can only control the way you react, and what actions you take when you hear what they say. So that's a great one for that. But we find that these self-control circles, self-care control circles help when you are feeling all this stress and you've been through traumatic events and you've got kind of all that weight on your shoulders. It is very helpful to separate it out into things you can and cannot control, because when you realize that you've been spinning your wheels and your energy and your stress on something, worrying and thinking and stressing about something that you can't control, that you have no control over, then it kind of helps you to let that go. And it also helps to focus on those things that you can control. So we found this, it's so funny because we found this graphic of the COVID control circles online, I think on maybe on Facebook, and then amongst us here at iCare, like 3 or 4 of us, we all sent it to each other, like, look at these Corona control circles, because it's just perfect. You know, you cannot control in this environment what others are doing, whether or not others are following social distancing, whether or not others get sick. You can control your attitude about it. You can control turning off the news, like we said earlier, limiting your media exposure. You can find fun things to do and make the best of your situation at home. You can find that positive lining, right? Like Tanya, I've been in my house with my 2 boys for a very long time, and that can be stressful sometimes. But the flip side of that is I have had all this extra time with them that I otherwise wouldn't have. And my baby is 3, you know, that's such a awesome developmental period to be able to be home with him and be spending a lot of time. So I can control finding the silver lining. And so I find this is very helpful for myself. It's very helpful for the students that I work with, as a mindfulness and a self-care technique. Go ahead.
Okay, so I would like to add to the circles, because one of the ones that I personally can identify with is the amount of toilet paper at the store, right? So just being concerned that I wouldn't have enough toilet paper for my mindfulness trip to the bathrooms. I can play it off so I can really go in there and meditate. And so I like being able to say the things that I cannot control and then match them up with the things that I can control. So for this particular one, the amount of toilet paper at the store, on the inside, the thing that I can control that would match with that is my positive attitude. And so what the thought could be is, I may not be able to find toilet paper at the store, but I could always ask my neighbor, you know, if I could borrow a couple of rolls if I need to, or I can call, you know, friends or family and say, can you please find me some toilet paper? And so being able to match those things up would also help relieve some of the stress with things that you cannot control.
All right, guys, so we are at the end of our presentation, and I'm watching the time. We have about 7 minutes left until we're done. So we have done a lot of self-care shares. We might kind of skip over that, so we have some time to answer your questions if you have any, and then wrap up. But just want to mention here that, you know, we kind of listed out these ideas of things that you maybe can do for self-care. And we've already shared a lot of other ideas. I think the reason we like to have people share ideas is because sometimes people mention things that we've never thought of before, and it's like, oh, I'm going to try that, or I can do that. So when you share, that, I think that's helpful to the whole group. And we really like to just kind of harp on the fact that self-care is not selfish. Self-care does not mean, oh, you're taking so much time for yourself. It means you are taking that time for yourself to make sure that you're well. And here's my empty cup graphic that I talked to you guys about earlier. You cannot pour from an empty cup, right? You can't pour into someone else's cup if you don't have anything in yours. So make sure you take care of yourself and teach your students and the kids that you work with that is an important thing for them to do as well. They've got to take care of themselves so that they can be their best self, and then in turn be their best community, family member, friend, to the people around them and the people they care about. I know that Tanya's going to go over our
Yeah, and I want to jump in about self-care, y'all. So, and I keep saying y'all. I feel like we're friends and family here today. We've been together so long. But I want to make sure that I say a term that I've learned since we have been going through this called radical self-care. So, normal self-care is what you do daily or weekly, you know, the bubble bath or just going for a walk in the park. We need radical self-care because we are going through radical stress, radical trauma, and it is so widespread that these layers, I keep saying the layers are just stacking up, right? And so I even think about what could be in the Gulf now. My director said that, have you seen the Gulf? Ah, oh my goodness, I have to take a deep breath just to even hear Gulf of Mexico. So practicing radical self-care means it is the responsibility to take care of yourself first before attempting to take care of others, filling your cup first so that you have the capacity to heal and move forward. And so the part that rang out with me is having the capacity. We talk about building capacity to heal and move forward, whether it is physical healing, emotional and mental healing, right? And so moving forward with the radical self-care means you go above and beyond what you would normally do to take care of yourself because we are being compounded with things that could possibly stress us all out and take us over the top. So practicing radical self-care, I want to just put that term out there. Feel free to look that up. And so quick ways to practice radical self-care. Nourishing your body. We talked a lot about that. Tackling old demons, old frames of thought, old things that when they come up, they kind of like take you over, right? Like my Katrina situation. Feeding your soul and your spirit, whether that's doing affirmations or mantras, whether that's journaling, whether it's eating hot chicken noodle soup or gumbo right now, like feeding your soul and making sure that you're feeling good. Believing in your worthiness. You are worthy. We went through the affirmations and the mantras, and a lot of people said, I am worthy. Yes, you are. And remembering that and saying that to yourself and saying it to our students. Setting boundaries. We talked about saying no and letting your no be your no and your yes be your yes. And then, of course, my favorite one is to play. Laughing, playing, engaging in fun activities. It is okay to do that as an adult. It is okay to do that as a professional because we deserve time to play and to engage in those types of conversations and do fun activities. And we want our children to remember to play as well because it's healthy for their development. Okay. And so Ashley has put up the questions. So if you have any questions for us, please let us know.
Yeah, please go ahead and put the questions in the chat because we just have a few more minutes and we want to make sure we get to any questions. Tanya and I, once we get going, we just like to keep on talking and keep on talking. So sometimes we don't leave room, but we want to leave room if you have any questions. Giving you a chance to type those in, just want to know that you can follow our agency, iCare. We are on Facebook, Twitter, and Instagram at iCare EBR. I do see some things popping up in the chat. We have 1 minute. We appreciate your some of your positive feedback that I see on here. So thank you for that. Do you see any questions, Tanya?
Everybody's saying it's great. We really appreciate that. Queso for everyone.
Tanya said, I know Tanya's muted. She said queso for everyone. She's joking. We're educators. We can't afford queso for everyone.
No, but we really appreciate you all. When we do this presentation, it allows us opportunity to, right here, echo. That's Ashley. It allows us opportunity to be able to express our concerns. We also, as Ashley stated, are actively going through trauma, have gone through trauma. We worry, we have concerns, and so just being able to do this presentation allows us to get those things out in a safe and healthy way, and also to get feedback for things that we can do. So we thank you, and please feel free to reach out. Ashley talked about liking us and subscribe. Like and subscribe. Click that like button on Facebook, Instagram, and Twitter. And you can also reach out to us if you need eye care support and you're in East Baton Rouge Parish. We have community partnerships. We work with groups of people. We provide free trainings. So please feel free to reach out to us through those avenues. And we have a quick community resource list that Ashley has put up. Our contact information is there to the left. And the resource gives our information. We have a 24-hour hotline email. You haven't heard that before. A hotline email 24 hours. Please give us 24 hours to respond to your request or your question. And we really appreciate your time this afternoon and for hanging in with us. And we hope that you enjoyed us as much as we enjoyed you all. Any questions? All right, everyone. You all have a good one. I don't see any questions.
Bye-bye. Thank you all for participating in the chat. We enjoyed ourselves. Thank you.